I'm not exactly back because I'm not at my normal station to do these videos, so you're not going to actually get to see me today, but I wanted to share something that looks like it might be pretty interesting. So I'm using a different computer in a different place, and I don't want to waste any time, so let's get to it. Welcome to another episode of You and Me and Multiple Sclerosis. My name is Pam, and I've been living with MS for over 40 years now. And as most of you probably know, I have recently had cancer surgery, which went very well, but it made my MS kind of mad, so I'm not able to walk at the moment, and it has really kind of put a crimp in my ability to post these videos. But even as such, we're going to do our best because this one looked pretty interesting. It's from I Conquer MS, and it's a project that they've started now, the confirmatory trial for alleviating fatigue in MS, and they call it CAFE MS. The CAFE MS clinical trial is a research project that claims to test how well online health programs work as a potential treatment for people with multiple sclerosis who experience fatigue. Fatigue is one of the most common and challenging symptoms reported by people with MS, but there aren't many effective treatments available to help manage it. You could say that again. By participating in CAFE MS, people with MS have a special opportunity to help develop new treatment options for fatigue and potentially benefit from the online health programs being studied. Participants are currently being recruited from the I Conquer MS community, an online MS research network, and will soon be recruited from the MS community served by the Department of Veterans Affairs MS Centers of Excellence. This clinical trial will take place from 2024 to 2027 and plans to enroll 2,000 people with MS from different backgrounds. To make sure that the trial represents the MS community fairly, people from minority groups and those living in rural areas are strongly encouraged to take part. I don't know if you noticed as I was reading earlier, this is going to be an online treatment program, which means there's not going to be travel to the clinical trial test site, which would be more often the case. So that does increase the ability for people in rural areas or people whose ability to travel long distances to get to a clinical trial site might be limited. Now, if we go over here, I want to just look at the program overview. We'll just take a look at the project overview. This large trial plans to enroll 2,000 people with MS, so it's a pretty large trial. The trial is a collaboration between Accelerated Cure Project, I Conquer MS, People Powered Research Network, and 5 Department of Veterans Affairs sites that are part of the MS Centers of Excellence. This partnership aims to make sure that the trial includes enough people with MS from diverse backgrounds who are often underrepresented in MS clinical trials. This will help ensure that the trial's results are applicable to a wide range of people with MS. People who join the trial will be asked to participate in study activities over the course of 1 year. Participants will be randomly assigned to one of 3 groups. 2 groups of participants will have access to different online programs for fatigue in MS for the first 6 months, in addition to their usual MS treatment. After the first 6 months, those participants may be able to access the other online programs if they wish. The third group of participants will only receive their usual MS treatment, so they're the placebo group, for the first 6 months. They will get to choose one of the online programs for the last 6 months of the trial. All participants will be asked to complete surveys throughout the course of the year. So let's scroll down here and see if we can look at the overview. Okay, so this diagram shows that for this clinical trial, after you go through the eligibility questions to make sure that you actually are qualified to be in the trial and you're accepted to be in the trial, then there are some baseline surveys that you take, and then there's the randomization that happens to put you in one of those three groups that we talked about a minute ago. And once that happens, there's a series of online surveys. And then finally, there's the extension phase with some more online surveys. So the whole thing is going to be online, as we said before. This is the email that I received that invited me to participate. And I'm just going to scroll a little bit here because there's a couple of parts that I thought would be worth us looking at together. And the one in particular is this eligibility criteria. So how do I know if I'm eligible to join? You may be eligible to join this study if all of the following are applicable to you. You live in the continental U.S. and its territories. You are at least 22 years of age. You have a confirmed diagnosis of MS by a physician who is a neurologist or has access to a neurologist's statement of diagnosis. You experience fatigue with your MS. You are fluent in English. You are willing to independently use an online program for 6 months and complete follow-up surveys. You have access to the internet and email with a compatible device, like a smartphone or a computer or a tablet. You have not had an MS relapse requiring steroid treatment in the last 4 weeks. You have not started a new disease-modifying therapy in the last 4 weeks. So those are the eligibility criteria. What they don't have on this list, and I couldn't find anywhere else, were the disqualifying criteria. And those would, I think, also be important to know, because there would be certain things that perhaps would keep you from being part of the study. But as you can see back here on the website, there's a link where you can join the trial. So there's the application. And then also there's a way here that you can keep informed. And if we click on that, you can get on their mailing list. And so you just give them your name and email and you can be put on their mailing list. So you could at least keep informed of what they're doing. Okay, so I've given you some information so that if you are interested in this, I know fatigue is almost the universal symptom for those of us who've dealt with MS for any length of time. And it is nice that this is going to be a totally online clinical trial. I'm sorry that they only are recruiting from within the United States because I know a number of you are from other countries. But if there are some good results that come from this idea of doing online treatment for fatigue, this can be made available to everyone in the whole wide world, right? So there might be some good that comes out of it for everyone. This video is not going to be up to my usual standards, I'm afraid. Part of the problem is that not only am I not able to walk really well yet, my optic nerve, which was weakened from all of the optic neuritis that I've had over the years, seems to be a little bit weak again, and so my eyes are not quite focusing correctly, and I'm having a little bit more trouble reading than I normally do. But I hope you bore with me through this, and I hope that this information was timely and somewhat interesting and helpful. And I really hope that someday I'm going to reach the end of the rainbow and get back to where I'm walking and able to use my regular computer so that you can see me back at my station with more information about what's going on in the world of MS. But in the meantime, please do keep taking really good care of yourself, as I am trying to do. And I will see you again in my next video.